Yes, in case of the chronic diarrhea, I would like to ask about for how long, how does it started, gradually or suddenly? Is it present for all of the time, or is it goes on and off like? And does it associated with any food, particular food like gluten containing pasta, oats, barley, etc.? And how much time he opens up his bowel per day? And how about his stool? Does it bulky in amount, or does it, what about the consistency? It is watery or semi-solid? What about the odor? Does it blood mixed? Does it easy to flush or difficult to flush? And some diurnal question like does the symptom awaken him from sleep? I think these are the question, and some symptomatic question like GIT related other question like any tummy pain, any throw up, any feeling sick, and other general question.
Okay, thank you. Okay, so when we actually ask the question, there is also our intention is to find out the cause. Our main intention is to find out the diagnosis. So every question must have an actually aim to find out the underlying cause. So let's see and the approach to patient with chronic diarrhea.
বুকে ব্যথা আছে? হ্যাঁ। কখন থেকে? সন্ধ্যার পর থেকে? সন্ধ্যার পর মানে কটায়? 8টা থেকে কটা বলে?
Okay, so approach to patient with diarrhea, and initially actually we all know about the definition of diarrhea. Is about amount. It can be classified according to the amount, more than more equal to 200 gram, or maybe frequency like 3 or more day actually. And I have already mentioned that the diarrhea can be classified into 3 categories: acute, subacute, or persistent, and chronic. And the etiology of acute diarrhea is different from subacute and chronic. They are overlapped actually. So if the patient presented with acute diarrhea, we'll consider one type of diagnosis, and if the patient with subacute and chronic diarrhea, they will be more or less same. So we'll also see the approach of acute diarrhea later on. At first, start with chronic diarrhea. Can you tell me what is this picture is actually? Can anyone tell me about this picture? Do you know what is this?
Consistency of stool.
Stool categorization, right? And this is Bristol. Okay, Bristol stool categorization. So according to this, we can categorize. We don't need this actually. I just give you an idea about the consistency. Okay, so this is hard stool. So regarding history taking of chronic diarrhea, we all know that any type of history, we should start with symptom analysis. Okay, so at first we need to be sure whether this is diarrhea or incontinence. There is a difference between diarrhea or incontinence. Actually, incontinence is the condition when a person cannot retain the feces. This is not diarrhea, but sometimes they may perceive as it diarrhea. So you should ask the patient, what do you mean by diarrhea? Okay, and is this difficult to hold stool or increased frequency of stool? This is the questions to differentiate between these two conditions. So you need to ask the patient. In case of station 2, not in station 4. In station 4, if they say that this is a diarrhea or loose motion, and then you can go for approach to patient with diarrhea. So you don't need to be different. You don't need to differentiate between this. Okay, but in case of station 2, you can ask this question: what do you mean by diarrhea? Then we all know the approach to symptom analysis, that is ODT para: onset, duration, timing, actually progression, associated feature, radiation, or releasing factor, and also aggravating factor. And in these circumstances, in case of diarrhea, duration is very important, because with the duration we can categorize the diarrhea whether this is acute or chronic. This is must. Okay, there is another important question you need to ask, because we know that most of the time the most common cause of chronic diarrhea is in functional disorder. We call it IBS, okay, inflammatory irritable bowel syndrome. So in that case, if you want to actually differentiate between the functional and organic cause, what you need to do, you need to ask few questions. And one of the question is whether you have diarrhea in at night time, and do you need to get up from your bed uh, for defecation. So you have to ask this question. And if they say yes, this is less likely to be organic cause. This is most likely to be organic cause. But if you say that no, I don't need to get out from my bed at night time for my defecation, I think, and this is less likely to be organic. So this is most likely to be functional cause. So you need to ask this question. This is very important question. And there are some certain aggravating factors which can indicate the etiology of diarrhea, like important foods. Like we know that more in our country and most of the Southeast Asian people, they don't have a lactase. This is an enzyme. This is responsible for the metabolism or degradation of lactose. And in that circumstances, there may be have lactose intolerance. So you need to ask about the food. Do you have any difficulty in do you have any loose motion after taking this food? And especially there is an important disorder, we call it celiac disease, and you need to ask about separately, do you have any loose motion after taking, or any tummy pain or bloating sensation after taking rye, wheat, barley, pasta? You need to ask about this, or bread. You need to ask about this to find out the celiac disease. And you can ask about this relieving factor. This is not that much important, osmotic and malabsorptive, and sometimes the book actually write about this, but I think this is not that much important. But important is the characteristics. And you need to ask about any blood. If you find any blood, there is a chance there might have inflammatory cause of diarrhea, like IBD. And another big category is malabsorptive type, and you have to be differentiate this at the very first, like whether this is malabsorptive type or not. You can ask three questions. One is it large amount pale? Is this sticky to the pen and difficult to flush away and floats on water? If the patient said this yes, then you will go for the malabsorptive category. Okay, and you will look for the malabsorptive category. And can anyone tell me about the what are the malabsorptive category of diarrhea?
Celiac disease, chronic pancreatitis.
Yes, they are actually categorized into mucosal or pancreatic.
Topically spuri. Short.
Yes, mucosal. This is celiac disease, tropical screw, small bowel bacterial
SPO
overgrowth.
small bar.
Bacterial overgrowth. This is the mucosal type. And pancreatic type, we all know just chronic pancreatitis or CA pancreas, right? So if the patient give history of this type of symptom, then you must look for this condition. So this is very important question to ask in very early stage of your history taking. Okay, and another important category is the inflammatory type. Okay, and inflammatory type actually indicates that there is some inflammation of the gut. And the questions of inflammatory diarrhea is there any blood or mucus associated with abdominal pain, and is there any systemic symptoms like fever, night sweats? That might indicate inflammatory type of diarrhea. So what are the inflammatory type of diarrhea? It may be celiac disease or ulcerative colitis. So we can see the big categorization. I can show you my diagnostic framework of chronic diarrhea. It might be intimidating, but I want to see you actually. I show you diarrhea. This is my categorization of diarrhea. Look at this. Actually, if suppose I don't know the case, and someone says me that what is your diagnostic framework of chronic diarrhea? Okay, so I have two broad category. This is GI cause, like Dr. Mitu, non-GI cause. Okay, and GI cause, I differentiate it into further category like large bowel and small bowel. In case of large bowel, it can be neoplastic, like colon, lymphoma. It can be inflammatory, ulcerative colitis, Crohn's disease. But Crohn's disease may also actually involve small bowel also. And then microscopic colitis. This is another type of diarrhea. Okay, and other causes of others in the category of large bowel is IBS. This is one of the most common cause of diarrhea. Ischemia, lactose intolerance. Okay, now small bowel, malabsorption. This is broad category. I have said about this, how to identify the malabsorptive type of diarrhea. So, and under the malabsorption, there are two categories: pancreatic cause, enteropathic. So, pancreatic cause, chronic pancreatitis and chronic CA pancreas. And in enteropathic type, celiac, tropical sprue, small bowel bacterial overgrowth. There are other less important cause, but these three causes you should keep in mind. Okay, there is also some rare cause like Whipple's disease, bowel surgery. They can also presented as malabsorptive type diarrhea. And other cause of small bowel is Crohn's disease. Crohn's disease can infect also large bowel and small bowel. VIPoma, ileal resection, this can cause. Then non-GI cause, I categorize into three categories: endocrine cause, infective cause, and others. In case of endocrine, this is diabetic autonomic neuropathy. It can be thyrotoxicosis. Addison's disease may present with diarrhea or may present with constipation also. And there are some neuroendocrine tumors, VIPoma, Zollinger-Ellison syndrome. They can also present it as diarrhea. And in case of infective cause, the two big category is HIV, which is very important for MRCP. And then another is if you give exam in India, tuberculosis, you have to also consider about this. And there are other HIV associated cause of diarrhea. We know all about this, and these are the cause. And Piercenia giardiasis. Giardiasis is another cause of chronic diarrhea, infective cause of chronic diarrhea. And interestingly, this giardiasis is presented as malabsorptive type of diarrhea, so you should keep it in mind. And there are some certain drugs. You all know that in case of MRCP, drugs causing the etiology or symptoms is very important. Sorry. Okay, so there are certain drugs which can cause chronic diarrhea, like metformin. Then that patient with diabetic patient, if the patient are diabetic, you should ask about the drugs, because metformin can cause chronic diarrhea. Colchicine, this is another is an anti-inflammatory drugs. Antibiotic associated diarrhea, we all know that pseudomembranous colitis, so we need to ask about this also. So these are the broad category. So this is, you may feel intimidated after seeing this actual list, but I can tell you that if you find that initially that this patient presented with malabsorptive type diarrhea, then you solely concentrate on these causes. If you find that this most likely this is a case of non-functional disorder, then you can put emphasis on IBS. And if you find that the patient has fever, night sweats, and also the patient has exposure history, you should consider this also. Travel history in case of tuberculosis. Can anyone tell me about this disorder, microscopic colitis? What do you know about this?
Due to antidepressant.
Sorry?
Due to antidepressant and NSAIDs.
Okay. Okay. If we actually want to differentiate between the causes and find out the actual causes of the patients presenting symptoms, we need to know about the disorders. Actually, we call this illness script. So illness script is a concept in which we actually think about the disease in a short term. Like, what do you know about microscopic colitis? And you have already mentioned that it can present it with a patient taking NSAIDs, right? and it is usually presented in case of elderly patient, elderly women. So if you, and it is presented chronic diarrhea, chronic watery diarrhea. Okay, so if your patient's profile match with this, then it can be a differentials of you. But if you don't about the microscopic colitis, then you will not be able to diagnose it. Okay, so you need to know something about all these disorders. Okay, maybe not elaborately, but at least a few things about these disorders so that you can identify the cause. Okay, so do anybody has any questions regarding this diagnostic framework? Okay, let's go to our previous slide, the approach. Our first step was ask symptom analysis. Now our second step is find out the differentials. So to find out the differentials, we need to ask about the specific questions. Oh, sorry. Okay, so like if you can ask about malabsorption taking rye, white barley, and in case of celiac disease, and you can ask about bone pain, proximal myopathy. We know that in case of celiac disease there has been many vitamin deficiencies, and you can ask about this. In case of tropical flu, you need to ask about any travel history, small bowel bacterial overgrowth. Any we know there are certain factors associated with small bowel bacterial overgrowth, like surgery, like systemic sclerosis also associated with small bowel bacterial overgrowth, maybe diabetes mellitus or immunosuppression. These are the associated small bowel bacterial overgrowth. So you need to ask about this if you suspect the patient might have small bowel bacterial overgrowth. In case of pancreatic cause, we know that chronic pancreatitis presented with recurrent attack of acute pancreatitis. We need to ask about the patient about any recurrent abdominal pain. So if the patient give history of recurrent abdominal pain associated with steatorrhea, associated with diabetes mellitus, you need to think about chronic pancreatitis. So you need to ask these questions. If you don't know about the disorders, then you will not ask this question, you will not find the diagnosis. CA colon, there are certain familial conditions, so family list is very important. And the other alternative diarrhea and constipations, elderly patients, that all can be a manifestation of CA colon. Lymphoma, the patient may present with lymph node. Patient may say that I have some lumps and bumps around my neck. Then you can consider lymphoma as your diagnosis. And there are certain causes that presented, causes of chronic diarrhea that may present with hepatosplenomegaly. Lymphoma is one of them. Okay, and IBD. In case of IBD, there are certain, I know that extra intestinal manifestation of IBD. Like in case of Crohn's, their patient may have some oral ulcer, and some patient may have joint pain. We know that IBD associated arthritis, they are so seronegative arthritis, and the patient may have some jaundice and some systemic features like fever, weight loss. In case of ulcerative colitis, patient presenting usually bloody diarrhea. In case of Crohn's disease, patient may present with bloody diarrhea or may be presented with only abdominal pain without diarrhea. So this varies. But in case of ulcerative colitis, patient will present with bloody diarrhea, and patient will have systemic features, joint pain, and jaundice. Okay, and in case of ulcerative colitis, we know that this is associated with PSC. Okay, and microscopic colitis, elderly lady with NSAID use, I've already mentioned. In case of IBS, we know that there are certain criteria of IBS. You don't need to be actually memorize this criteria, but you have to have some basic knowledge about IBS. Usually IBS is a disorder of young patient, and this patient has other functional disorder, associated functional disorder, and there might have some stress component. And during your communication with the patient, you have to be very careful about finding out the stress. And if you ask the patient that do you have any stress in your life, he will not tell you. You have to ask actually in more indirect way. So you can ask about what about your job, how this is going on, is there any problem or facing in your job. If you ask like this, and then they will tell you about their condition. And small bowel ischemia usually presented with bloody diarrhea, and this patient is elderly patient, and they are usually associated with some they have multiple cardiovascular risk factors. Like they might have ischemic heart disease, they might have dyslipidemia, or most of the cases they can give you the history of atrial fibrillation. In such patient, you need to think about this. Patient presented with bloody diarrhea, with multiple cardiovascular risk factors, with associated arrhythmia, you need to think about this. And I have already actually discussed about lactose intolerance. Whipple's disease is an interesting disease of elderly and middle-aged man. Okay, and these patients usually presented with multi-system disorder. The patient may present with may presented with dementia, joint pain, all sorts of problem. And in that circumstances, you need to think about this. But fortunately, this type of rare diagnosis usually not presented at PACES exam. So, but if you want to be, if you want your preparation actually complete, you need to know about this disorder. And infective cause, I already discussed about this, and details drug history, and especially laxative abuse in young patient. This is one of the common causes of chronic diarrhea in young, as well as the IBS. Endocrine cause, we know that there are certain features of endocrine cause thyrotoxicosis. We all know the features of thyrotoxicosis. We can ask about this. We can ask about the Addison's disease, like weight loss and weakness and pigmentation. We can ask about this. Diabetic autonomic neuropathy, usually associated with long-standing uncontrolled diabetes mellitus, and this patient usually have multiple microvascular complications. So you need to ask about this if you consider this endocrine cause. And suppose you find the endocrine diabetic autonomic neuropathy as your diagnosis after asking all these questions. Then step 3, you have to find out why his diabetes is not controlled, not well controlled. What is the reason behind this? You need to find out a solution of this. Might be patient has there is nobody to take care of him or her. So you need to think about this. You need to find out the reason behind your etiology. This is our third step. And if you can reach this step, you will get the full marks. And step 4, you need to ask about other history, like family history, travel history, all these histories you have to take systematically. And the important thing is giving feedback. And giving feedback is an art. And if you practice a lot, you can give it. And feedback actually depends on your underlying diagnosis. In case of IBS, you feedback. In case of your feedback, you can usually in case of feedback, we tell about the pathogenesis and in layman terms, and we give our possible plan regarding investigation and management. Then we can give patients some advice. In some certain circumstances, we can give some treatment also. Like if the patient presents with joint pain, we can give some painkiller. But in case of IBS, we can give him or her some advice, lifestyle advice. Okay, taking actually not taking excessive tea or coffee, reducing stress, these sorts of advice we can give. So feedback and addressing concern depends on the actually underlying diagnosis. And this is all about the approach, in history taking approach. Do you have any questions? If you have any question, you can ask.
Can you please repeat the causes for acute diarrhea?
Acute diarrhea. Okay, I will discuss it later on. Okay, I'm just discussing the chronic diarrhea. And this is about chronic diarrhea, and there is long list. So in case of chronic diarrhea, usually chronic diarrhea actually this type of history is given in station 2. So you will have enough time to ask all these questions. Just you need to know that you need to ask these questions. So you need to ask all these questions and then find your diagnosis and give appropriate feedback. The next step is investigation, and investigation also depends on your underlying cause. Suppose if you think that your diagnosis is IBS, then you don't need to do extensive investigations. Then we all know that in case of IBS, we only can do certain investigation like full blood count, ESR, CRP, and serological testing for celiac disease. If all these tests are normal, then we can, and we have then the patient has typical symptoms of IBS, then we can diagnose it and we can treat it. So, and if you think the diagnosis, the condition, your diagnostic condition is like this is the management of IBS. I think this is not that much important, and I am skipping this. And if you think that the cause is malabsorptive type, okay, then sorry, just hold on. Okay, malabsorptive type, then you can do diagnosis of malabsorption by fecal fat estimation or fecal elastase test. Then you can find out the etiology, like do celiac serology, pancreatic. If you think that there might have pancreatitis underlying cause, then you can do CT abdomen. And in case of different types of intolerance, you can do different types of breath test. And you can do also CBC in case of, we all know that in case of malabsorptive type, there is some malabsorption of vitamins. So you need to actually do like calcium, B level, DEXA scan. This is important. In case of celiac disease, you need to actually investigate this also. So this is the feature of celiac disease. We all know about this. So this is the test of celiac disease. So I will not discuss it further. And in case of celiac disease, the management is gluten-free diet. You can refer the patient to appropriate dietitian who can give her advice regarding celiac disease. So this is about chronic diarrhea. If anybody has any questions regarding chronic diarrhea, you can ask. No question. So I can ask anyone. Dr. Afrina, are you there? Okay, so.
Yes, I am here.
Okay, can you tell me some causes of acute diarrhea? Someone is asking about this.
Acute diarrhea cause in broad category, maybe acute gastroenteritis, food poisoning, infective cause,
Okay.
and some drug cause like antibiotics, cytotoxic drugs.
Okay. Okay, nice. So when we say that this is acute diarrhea, when will you say that this is an acute diarrhea? When? I've already mentioned it actually.
Sorry, Bhaiya?
When will you say that this is acute diarrhea or this is chronic? What is the diagnosis? What is the definition of acute diarrhea?
If diarrhea persists less than 2 weeks, then we call it acute diarrhea.
Okay, yes, good. Okay, we'll discuss about the acute diarrhea after the break, and I think you can join with same link, okay, after 2 minutes.